Good evening, all. I am Dr. AARATHY from Drona. So we'll be continuing with the 2025 question paper from question number 61. We have completed the 60th question. So 61st question is about, according to Bela Samhita, which of the following is divided by Vayu to form Yamala Garbha? Which of the following is divided by Vayu to form Yamala Garbha? So twin pregnancy happens by the division of which one of the following? Number 1 is Shukrartava, number 2 Bija, number 3 Kalala, and number 4 Budbuda. So Vayu Kalalam Bitva is what Bela also says. Charaka also says the same thing. So when you study about this Masanumasiga Garbhavriddhi, each and every masa has its own importance, and you have to study all those, the opinions of Charaka, Sushruta, Vagbhada, as well as Kashyapa is also very important. Along with that, Bheda Samhita also, certain points you will have to note down. So in Yamala Garbham, Kalala stage is being divided by Vayu to form Yamala, and according to Charaka, the reasons mentioned to form Yamala Garbha are like, according to Charaka, Adi Pravrata Vayu and Purva Karma of Garbha. Adi Pravrata Vayu and Purva Karma of Garbha are the reasons. While for Kashyapa, it is Samana Karmatvat, Prak Nadi Egatvat, and Tulya Nishekat. Samana Karmatvat, Prak Nadi Egatvat, and Tulya Nishekat. These things can be asked as assertion reason questions. So each and every phrase should be noted down. Now, according to all these result in Tulya Lakshana Agradi Pragrati individuals, which means twins. But what is different between the twins? Tripti and Visarga of both the fetuses are different. And as far as Haritha Samhita is concerned, the reason for twin pregnancy is Kritamanecha Sambhoge Dravate Manaha. Kritamanecha Sambhoge Dravate Manaha, which means flickering mind of couple results in Yamala Garbha. Now, when you study this, you have to note down the shape of the kukshi or shape of the Garbha also. Mother's, kukshi. According to male, female, twins, and Nabumsaka. Usually we get confused with twins and Nabumsaka. So make a note of it, write it in your confusion book, and then study that also. Okay. Now, 62nd. Balino Bahudoshasya Snigdha Swinnasya Shodhanam Urdhva Adi Kuryat Sneham Yad Nakarshana. As per Ashtanga Hridaya, this treatment is mentioned in which of the following disease? So the first option is Rajakma, second one is Jwara, third Hridroga, and fourth Raktapitta. So treatment principles, as I said, for KC diseases, it is very important, especially Rajakma is one of the most important diseases. So for Rajakma, you have to be aware with the 4 Nidanas, specifically 4 Nidanas, the types mentioned by each Acharya. In addition to that, the main Purva Rupa, Rupa, all these, then Shadrupa, Egadasharupa, all these have significant importance. So do go through all those things. When it comes to the treatment, you'll have to study specifically what treatment is mentioned for which Nidana, Nidana Janya Rajakma. So treatment of Rajakma, Balino Bahudoshasya Snigdha Swinnasya Shodhanam Urdhva Ado Yakshminaha Kuryat. That Yakshminaha was missing. Yakshminaha Kuryat Sasneha Yada Nakarshana. And there are a few important quotes regarding Rajakma. Purisham Yatnato Rakshet Sushushyato Rajakminaha Sarvadhatu Kshayatasya Balam Tasyahi Vidbalam. Similar quotes are found in, this is from Ashtanga Hridaya, similar quotes are found in Charaka and Sushruta also. So take note of those quotes also. And the options other than Rajakma given are Jwara, Hridroga, and Raktapitta. All these are important on its own. Jwara is the most important KC disease. You have nothing to leave in Jwara. So please study in detail. Now, 63rd question. According to Ashtanga Hridaya, association of doshas in Suryavarta Shiro-roga are. So, coming to Shalakim paper 2, you have Shiro-rogas, Kapala-rogas, Karna, Nasa-rogas, and Mukha-rogas in it. So, in that, the most important portion, when you take the weightage, the most important portion is Shiro-roga itself. So these Shiro-rogas, every single one should be studied in detail along with the treatment also. For Suryavarta, as I told you earlier, whenever you study Shalakim, you will have to keep a separate paper, write down all those dosha predominance of each disease. Write the disease, which Gada diseases, if it is of eye disease, if it is mention it whether it is Sandhi, Vartma, Shukla, Krishna, or Sarva, or Drishti. If it is Shiro-roga, then mention it Shiro-roga. Then write the disease, and then dosha predominance according to Sushruta and Ashtanga Hridaya should be noted separately. But when it comes to Shiro-roga, you have all the acharyas telling different dosha predominances for each roga. Okay, so that is one big confusion point which you have to note it down separately. And also the site differs for each roga. Like site of pain, you will have confusion with the pain sites of Anantavada, then Ardhava-vedaga, Suryavarta. All these have different pain sites, and they have different mode of for example, in Suryavarta, by sunset it comes down, right? But for Ardhava-vedaga, it will increase along with the sun. So this is how it is said. The nature of pain also differs. That also you will have to note down. Also, the treatment aspect of each roga, each Shiro-roga has some confusions or some confusion points regarding each acharya's opinion. So that also is one important thing. Okay, so note down those things in your confusion points and study specifically the dosha predominance. Now, 64th question. Which of the following is not a content of femoral sheath? Femoral artery, femoral nerve, femoral vein, and femoral canal. As you can see in the picture, the contents of the femoral sheath are artery, vein, and lymphatics. Okay, so the answer, which is not the part, is femoral nerve. Now, femoral sheath is a triangular area or funnel-shaped structure, sleeve of fascia, which encloses the upper 3 to 4 centimeter of the femoral vessels. It is a funnel-shaped structure which encloses the upper 3 to 4 centimeter of the femoral vessels. You can see artery, vein, and the lymphatics inside this, right? Now, lateral compartment will have the artery, and the medial most compartment has the lymphatics. Structures outside the sheath, that is, the structures that are present outside this femoral sheath are femoral nerve and the lateral cutaneous nerve of thigh. So here the answer is femoral nerve. Now, you can get confused with the femoral sheath and femoral triangle. Both are different. So for femoral triangle, when you are asked what are the contents of femoral triangle, it is femoral nerve and its branches, femoral artery, femoral vein, femoral canal, which is the empty space that it contains, and deep inguinal lymphatic nodes. So to have a gist of it, you can take it as navel, where NAVEL. You can take it as NAVEL. N denotes nerve, A denotes artery, V denotes vein, E is the empty space or the canal, and L is the lymphatic nodes. Then 65. According to Charaga, generally in which of the following seasons Nasya is given? The options are Pravrit, Hemanta, Vasanta, Varsha, Sharad. So, according to Charaga, also other acharyas have also mentioned different Nasya Kalas, right? So, Ashtanga Hridaya, Ashtanga Sangraha, and Sushruta, they have mentioned as for Vada dosha, it is Aparahna, Pitta dosha, it is Madhyana, and Kabha dosha, it is Purvahna. It is very easy to remember because the dosha Kalas respectively are mentioned. Okay. Ashtanga Hridaya also mentions Nasya timing for Swastha also, according to Ridus. So in Hemanta and Shishira Ritu, it is very cold, right? So Madhyana is the preferred timing for Nasya in Swastha, according to Ashtanga Hridaya. The same way, Sharat and Vasanta have a hot climate. So there it is Purvahna. And in Grishma, it is again more hot. Then Sayahnam is mentioned by Ashtanga Hridaya. Another word, Aparahna, is also taken. In Varshakala, Ashtanga Hridaya mentions Aditya Darshana. So in Hemanta and Shishira, it is Shidagala, hence it is Madhyahna. Sharat and Vasanta, it is Purvahna. Grishma, Sayahna or Aparahna. And Varshakala, Aditya Darshana. This is according to Ashtanga Hridaya. There's only one confusion point over here where Charaka mentions Purvahnam for Grishma also. So do take note of that. Now, Sayam Pradar Dine Dine. This is one other condition Ashtanga Hridaya mentions for certain diseases. Which are they? Obviously, it will be Vada predominant diseases, right? So Vada Abhibhuda Shiras, Hikka, Apadanaka, Manya Stamba, and Swarabhramsha. These are the conditions where Sayam Pradar Dine Dine Ashtanga Hridaya advises Nasya. Note this conditions also. Ashtanga Sangraha also advises Ratri Kala Nasya Prayoga for certain diseases, which has been given here. You can take note of it. And in the question, it is asked as per Charaga, right? Charaga advises Kaleshu Trishu. What does this Kaleshu Trishu means? It is Pravrit, Sharat, and Vasanta. Pravrit, Sharat, and Vasanta, those are these Kaleshu Trishu. Now, usually, Nasya is not advised in night, right? But Sushruta and Sharangadhara mentions that Utkade Gade, it can be done in night. Utkade Gade, which means when severe cases, when there is a flare-up of disease, immediately you can also perform Nasya in night time. Then, number 66. For Nasya, you have to go through the types each Acharya mentions. Also, the procedure of Nasya, Pradhamana Nasya, Pratimarsha Nasya, all these are very important. Okay. 66. In the context of which Vasti, Acharya Sharangadhara has mentioned the use of blood of goat, sheep, and deer. So, number 1 is Siddhavasti, number 2, Pichilavasti, number 3, Samshavanavasti, and number 4, Yapanavasti. So, in this case, Vasti, when you mention the types, when you take the types itself, Sharangadhara, Sushruta, and Bhava Prakasha mentions Deepanavasti and Pichilavasti as 2 types of Vasti. Okay, so for Sharangadhara, the answer denotes or the answer points to Pichilavasti more. Now, what is Pichilavasti? Kashaya of Shalmali, Dhanva, Nagara is used. Kashaya of Shalmali, Dhanva, and Nagara is used along with Kshiram and Kshaudram. Kshira Siddham, Kshaudra Yuktam. The dose is 12 pala and this contains Aja Urabhra Ena Rudira. Aja Urabhra Ena Rudira is also mixed with this. Sharangadhara Samhita, Uttarakandham is the reference, 6th chapter, Niruhavasti Vidhi. So, Pichilavasti is the answer. Now, number 67, given below are 2 statements. According to Charaga, Manda Vibhransha refers to Hraswamatra of Snehapana. Statement 2 states, according to Charaga, Swedana is contraindicated in Madhumeha patient. So, in Panchakarma, the contraindications and indications are very, very, very important. You will get 2 or 3 questions from that single topic. So, this question paper also has 2 questions right from the indications and contraindications alone. Okay. So, the statement is Manda Vibhramsha is not Hrasva Matra, but it is Madhyama Matra, right? So, the statement 1 is incorrect, while statement 2 is correct. And for statement 2, you have contraindications mentioned along with the reasons why Swedana is contraindicated in Madhumeha patient, why Swedana is contraindicated in Staulya Rogi. So, those reasons are also very important. They are important because assertion reason type questions can be asked from such areas. So do take note of those areas. Now, indications of Snehapana, you have to study about the general indications and contraindications, as well as it should be according to Ashtanga Hridaya, Sushruta, and Charaka. So if you have studied any of the shlokas, then do stick on to the shlokas and just note down the extra points mentioned by other acharyas. It is always good to stick on to such things, like whenever you have difference of opinion of acharyas, it is always good that you study what you have already studied should be made thorough, then note down the difference of opinion alone, so that it will be easy for you to study. Now, the general indications and contraindications are to be noted, along with indications of the Chatusneha individually. That is also to be noted. So, as far as Chatusneha indications are considered, there are a lot of confusion points, like Krura Goshta, the condition Krura Goshta, which type of Sneha is mentioned by Charaga, which is mentioned by Sushruta, and which is mentioned by Vagbada. That is one confusion point. You can go and find it out what is mentioned. Then for Yoni, I think Yoni Kshalana, right? Yoni, yes. For Yoni Kshalana, what Yoni Shodhana, not Shalana, Yoni Shodhana, which type of Chadusneha is mentioned by Kashyapa and which is mentioned by Charaka. That is also yet another confusion point. So you can note it down. Then for Yoni, Bhrashta Yoni, which Sneha is mentioned, that is also that is not a confusion point, but it can get confused with Yoni Shodhana. So you can note it down together. So all these points are very much important. So Deeptavanni with Sneha, for Mahakshut with Sneha is indicated. All those things you have to note it down. Now for Sweda indications and contraindications, general contraindications and indications should be noted along with the points that I have mentioned before, like reasons for why Swedana is contraindicated in Madhumehi, why it is contraindicated in Sthaulya. Such 3 or 4 conditions are mentioned. You will have to take note of that also. Now, the next question, 68, is yet another very, very, very important question, very, very important area, which would seem to be very easy, but one of the most confusing areas in our, AIAPGET examination areas. This forms one of the main confusion area, but it's actually interesting to study, but you have to give a little repeated reading for this portion. And I would suggest reading it every week, once or twice. You have to go through this portion, make a separate note of this thing, and then keep on reading. So what is that portion? It is the Dosha, Dhatu, Mala, normal functions, Kshaya, Vriddhi, Lakshanas. Okay, it is very important to study these because you can get 1 or 2 questions. In this examination, I think 2 questions have been asked from this portion. So go through all those Lakshanas. I shall mention a few confusion points here. So Sandhi Shaithilya. Sandhi Shaithilya is for Kabhakshaya, while Sira Shaithilyam is for Shonidakshaya. Right? Damani Shaithilya is for Mamsakshaya, while Sandhi Shunyata is for Medokshaya. Hrid Shunyata is for Rasakshaya. So for Shaithilya, see, Sandhi, Sira, and Damani are there. Sandhi, it is Kabhakshaya. Sira, it is Shonidakshaya. Damani, it is Mamsakshaya. Sandhi Shunyata, Hrid Shunyata, and Udara Shunyata. Sandhi, it is Medakshaya. Hrid Shunyata is Rasakshaya. Udara Shunyata is Medakshayam according to Chakravarti. Okay, so this is how you have to note down the confusion points. There are a lot of confusion points in this one portion itself. So make sure you write it down separately and then have a repeated reading of this portion. Now, 69th question. As per Sushruta, the measurement of hole in Arsho Yantra is, as you know, Arsho Yantra is one of the easiest yantras to study the measurement, because you have a particular sequence following, like 3, 4, 5, 6, right? Because how is it 3, 4, 5, 6? Like there are 2 types of Arsho Yantra. It is a Nadi Yandra, right? Arshoyandra is a type of Nadi Yandra or rectal speculum. It is of three types. It's not two types, it is three types of Arshoyandra. So the Pramana goes like this. Length, it is the Chidra measurement is 3 angula and it is Angushtodara Parinaha. Angushtodara Parinaha and the Chidra, the whole is of 3 angula. While length of Arshoyandra for male is 4 angula, Hastadala Ayadam, and the total length, it's not for males alone. The total length is 4 angula, Hastadala Ayadam, and while it comes to the circumference, for males it is 5, and for females it is 6 angula. So the Chidra is 3 angula. You have 3 types of Arshoyandra. The Chidra is 3 angula. It is Angushtodara Parinaha. Then the length is 4 angula, Hastadala Ayadam. And the circumference for male is 5 angula and the female is 6 angula. So this is how it follows 3, 4, 5, 6 pattern. Okay. The size of the slit should be 3 angula, which is 6 centimeter in length. And the middle of the thumb is the circumference. That is Angushtodara Parinaha. And Ega Chidra and Dvichidra. 2 types are there. According to the number of holes, it is Dvichidra is used for Darshana and Ega Chidra is used for Karma. Other yantras mentioned are also very important. You have to study the total number, then the measurements of each yantra and the usage of each type of yantra. Okay, and the most confusing point which I have felt regarding yantra and shastra are the yantra karma, that is yantra guna and doshas. They are both confusing. For you will not know whether it is yantra guna or shastra guna, yantra dosha or shastra dosha. Also, yantra karmas, the numbers are okay with both, but then what all karmas are mentioned for yantras and what are mentioned for shastra. The karmas are still more easier, but the guna and doshas give you a confusion. So note them down, put some relations, and then study it. 70th one. Given below are 2 statements. Statement 1, according to Acharya Charaka, Basti Netra should be of 8 angulas long for 12-year-old person. And statement 2 states, Charaka has described 8 Vastidhata doshas. Vastidhata doshas are 8 according to Charaka. This is what statement 2 says. So, statement 1 is correct, while statement 2 is incorrect, right? So, you have to study the measurements of Basti Yantra, then the Moolam, that is the outer circumference, the inner circumference, or the Moola Chidram, the Karnika, where at what point the Karnika, at what length the Karnika should be placed, according to age, what length is good, and what Agra is mentioned. Agra Pramana of Basti Yantra, all these you have to study according to Charaga, Sushruta, and Ashtanga Hridaya. Ashtanga Sangraha. Okay, Ashtanga Hridaya goes hand in hand with Ashtanga Sangraha except for a few points. Otherwise, it is similar to Ashtanga Sangraha itself. So, do study those. Also, the second statement was regarding Basti Doshas. So, Vyabhat, Basti Vyabhat, that is Niruha Basti Vyabhat. There are 12 according to Charaka and 76 according to Sushruta. According to Charaka, the 12 are Ayoga, Adiyoga, Klama, Admana, Hikka, Hrit, Prapti, Pravahika, Urdhvagamana, Shirashulam, Angamardam, Parikartika, and Parishrava. Do try to study the symptoms for each one of these. A bit tough, but still it is worth studying. Now, according to Sushruta, Pidana dosha is 4, Basti Pudaga dosha is 5, Pranidhana dosham is 6 according to Sushruta, Shaya dosham is 7, Vaidya Adura Nimitam is 8, Vaidya dosha is 9, Dravya dosham is 11, and Netra dosham is 11 according to Sushruta. While Charaka and Ashtanga Hridaya states Netra dosha as 8, Basti Pudaga dosha also 8 according to Charaka and Ashtanga Sangraha. Shaya dosha is not mentioned by Charaka, but Ashtanga Sangraha mentions 7 as Shaya dosha. Praneda dosha is 10 according to Charaka, while Ashtanga Sangraha mentions 9. And that is what is asked. It is mentioned as 8 in the question, but actually Praneta dosha is 10 according to Charaka. Now, what all doshas for or Vyabat, Charaga and Ashtanga Hridaya is not mentioned for Niruhavasti. There is Vaidya Adra dosha, Vaidya dosha, Dravya dosha, and Pedana dosha are not mentioned by Charaga and Ashtanga Sangraha for Vasti Vyapat, especially in Niruhavasti. Okay. So do study all those Vyabats and also the Lakshanas of each Vyabat. Also, Netra Vyapat according to Charaka, which is 8 in number, that is also important. Vasti Pudaga Vyapat is 8. You have to study what is these one words are more than enough for those Vyapat. So do go through these. It is easily relatable. Now, Pranidhana dosha was one question, right? So, Savada, Adidruta, Utshipta, Tiryak, Ullupta, Kambida, Adiga, Bahyaga, Manda, and Adivega. These are the 10 Pranidhana doshas. You have to also go through the main symptoms and the treatment. Those are given in the table. So you'll have to go through the main symptoms and the treatment given for each of the doshas. This is about Snehavasti Vyapat. Until now, we were talking about Niruhavasti Vyapat. Now, this is Snehavasti Vyapat. It is 6 according to Charaga, 8 according to Ashtanga Sangraha and Sushruta. The 6 according to Charaga are Vada, Pitta, Kabha, Atyanna, Purisha Avrata, and Abhukte Pranita. Those also has reasons why it becomes Vada Avarana, why it becomes Pitta Avarana. So that way it has clinical features mentioned and treatment for each of those. Those are also important. Just go through them. Now, 71st question. What is the order of progression of lesions in chickenpox? Macule, papule, vesicle, pustule, and crust. Most of you must have, might be aware of chickenpox. Either you might have experienced personally or you might have seen someone having that, right? So, macule, papule, vesicle, pustule, and crust. This is the same order of progression of lesions in chickenpox. So, chickenpox lesions appear in successive stages, and the stages, all the stages are present at the same time. That is what the speciality is. It is a polymorphic rash, actually. The typical sequence is, the first thing is macule. They are small, flat red spots, which is the first stage of rash. The first stage of rash is macule. They are flat spots, red in color. They are seen mainly on trunk, and then it passes on to faces and limbs, excluding palms and soles. Okay, palms and soles do not get lesions or scar, macules or rashes. So this is small correction here. It is not centrifugal distribution. It is centripetal distribution in chickenpox. Okay, so it is centripetal. Centripetal means it starts centrally and then it progresses towards the face and limbs or extremities, especially. But palms and soles are spared, and even if it goes towards the extremities will have minimal rashes or less rashes than the trunk. Okay, so that is called centripetal distribution. There's another distribution called centrifugal distribution. Do check which all diseases come under centrifugal distribution. What means centrifugal distribution? It is nothing but the rashes do start in the trunk, but most of the rashes, they go start in the trunk and spread to the limbs, but most rashes are found in the limbs in case of centrifugal distribution. Here it is centripetal distribution. Do correct, note the mistake in the mentioned here. Now, the second one is, the first one was macule. The second one is papule, which are raised red bumps, which develops within hours from the macules. So macules are flat red spots, while papules are little raised like red bumps. Okay. The third stage is vesicle, which is also called dewdrop on a rose petal. It is because that clear fluid fills inside the bumps and it becomes blisters. That stage is called vesicle, and which is the very characteristic feature of chickenpox is this vesicle. They are thin-walled vesicles, actually. And the fourth stage is pustule, wherein you can see a cloudy fluid inside the vesicle, which is because the inflammatory cells infiltrate into the blisters. So the fluid becomes cloudy, and this happens after 1 to 2 days of appearance of the blister. So first one was macule, which was flat red spots. The second one was papule, which is red raised bumps within few hours from macules. The third stage was vesicles, which is a fluid-filled blister, clear fluid-filled blister. It is also called dewdrop on a rose petal, which is a characteristic feature of chickenpox. And the fourth one is pustule, which is the vesicle becomes cloudy due to the infiltration of inflammatory cells, which occurs 1 to 2 days after the appearance of blisters. Now, the fifth stage is crust or scab, where the lesions dry and form the crust, and this occurs by day 5 to 7, and this heals without scarring. So unless secondary infection is present, this crust or scab heals without any scars. Okay, so the lesions progress from macules to papules to vesicles to pustules to crust or scab. This is the order. Now, the next question is 72. It is a match the following question related to AYUSH GK. So, there are centrally sponsored schemes and central sector schemes, right? So, these options come under central sector schemes. Central sector schemes are Ayurgyan scheme, Ayur Swasthya, information, education and communication, promotion of international cooperation, Augusty and Vriksha Ayurveda. These 6 schemes come under central sector schemes. Ayurgyan scheme. Gyan means knowledge. So as the name indicates, it is for the capacity building and CME in Ayush population. Okay, so that is what Ayurgyan scheme is. Now, Ayur Swasthya scheme. Ayur Swasthya scheme means, Swasthya, which means health. So it is something related to public health and sports medicine. Okay, intervention of Ayush in public health and sports medicine. That is Ayush Swasthya scheme. Now, international cooperation scheme. International cooperation, as the name indicates, you need to boost Ayush products internationally, right? Not only Ayush products, but also Ayush services, Ayush knowledge, the research, everything should be spread out internationally. So that is international cooperation scheme. The services, the education, research, and global trainings are done by the scheme. Okay, to boost Ayush. Now, the fourth one is information, education, and communication. So, information, education, and communication, as the name suggests, information about Ayush schemes, Ayush knowledge, then education-related things regarding this Ayush streams, and communication regarding our programs, different schemes or different, progresses in Ayush. Those are given out, or those are spread to the public. Now, Augusty. What is Augusty? Ayush Aushadhi Gunavatta Evam Utpadan Samvardhan Yojana. So, Ayush Aushadhi Gunavatta Evam Utpadan Samvardhan Yojana. The name itself suggests what it is. It regulates the Ayush medicines in association with the Drugs and Cosmetic Act 1940. It also enhances the manufacturing and exporting of Ayush medicines. Not only enhances the manufacturing, but also it, regulates the quality control and the safety monitoring of the Ayush medicines. Also, misleading advertisements by many, quacks, many companies. These are all regulated by Ayush, this Augusty scheme. Okay, surveillance of misleading ads of Ayush drugs. So these are the functions of Augusty, or that functions that are performed under Augusty scheme. So do study the expansion of Augusty, Ayush Aushadhi Gunavatta Evam Utpadan Samvardhan Yojana. Now, the last one is Vriksha Ayurveda. As the name suggests, it is regarding conservation, development, and management of medicinal plants. So, these are the central sector schemes. Now, when you read AYUSH GK, you need to keep on repeating the reading. You cannot just sit and mug up all the facts, or you cannot memorize everything in a go. So the best way to study Ayush GK is to repeatedly reading it out. I'm not talking about learning it, just repeatedly read it for 5 to 6 times, so that you have a picture memory, you have a reading memory of it. Okay. And do not keep it for the last moment reading, because your brain won't work that way. Keep on reading it from now itself. Just read one page every day, so that you can complete the whole thing by the end of 1 month. Again, give a reading, so that you can complete the second reading by the second month. So this way, that by the time your exam comes, you will have read it 5 to 6 times, and that is more than enough for Ayush GK. While you have to just concentrate on certain points like years. Like, for example, in this Drug and Cosmetic Acts year, Drug and Cosmetic Rule year, Magic Remedies Act year, Ayush establishment year, when was, the dates and years have a little significance, because this year, like in 25, they have asked 2 dates, 2 years in your question paper. Okay. Now, question number 73, consider the following facts regarding Mahayoni. So, permanent opening of vaginal introitus. Female has pain in groin region and all joints. It occurs due to Ruksha Guna of Vayu. Veshavara Pinda is used to treat Mahayoni. Now, choose the correct answer from the options given below. So, for Mahayoni, it is Vivratacha Mahayoni, according to Sushruta. So, according to Charaga, it is also mentioned that Vishamam Dukkha Shayaya, Maithunat Kupido Anilaha, गर्भाशयस्य योन्याश्च मुखं विष्टम्भयेत् स्त्रियाः असंवृतमुखी सा आर्ते रूक्षफेन अस्त्रवाहिनी मांस उत्सन्ना महायोनिः पर्ववंक्षण शूलिनी. So this is what for Mahayoni. So here Vivratacha Mahayoni, which means permanent opening of vaginal introitus. So Mahayoni is considered as the Precedentia, or the 3rd degree prolapse, right? Where uterocele, rectocele, and cystocele is seen. So permanent opening of vaginal introitus. And now you can see in the second statement, it is given, female has pain in groin region and all joints. So they have converted the Sanskrit words into English, right? So pain features and pain sites are different for different yoni rogas. It is very important. It is yet another confusion point which you can note. For Vadigi, the pain is somewhere else. For Paitigi, it is somewhere else. For Paripluda, it is somewhere else. So you have to, for Mahayoni, it is in groin and all region, all joints. Like so, each disease has the pain sites specifically mentioned. Those have to be noted separately. Now, it occurs due to Ruksha Guna of Vayu. The Nidana is mentioned specifically as Vishamam Dukkha Shayaya. Vishamam Dukkha Shayaya. And now, Veshavara Pinda. The treatment for each yoni roga is also mentioned specifically. Those are also to be noted down. So, one Vada predomina condition is Mahayoni is one Vada predomina condition where you can use Veshavara Pinda to treat Mahayoni. So, the answer is the 4th option. Vishamam Dukkha Shaya. The dosha, what is the samprapti of this disease? Vishama Dukkha Shaya is a nidana. It causes dosha to get vitiated, and it causes yoni vishtamba, peshi visamghatana, and then prolapse occurs. Utsanna mamsata. Doshas involved are Charaga. According to Charaga, it is Vada, and Sushruta says it is Tridosha. Dosha is Mamsa, Sthana is Yoni, and Ashraya is Garbhashya. Ashraya is Garbhashya. Okay. Now, it's not Ashraya, it's Ashraya. Okay. Now, 74. Which bhava is responsible for Indriya Prasada? One important, portion in Prasuti. The Shad-bhavas. It is not so important that you note down the numbers of each bhava, but at least you have to go through the bhavas for each acharya. So here, Sushruta and Ashtanga Sangraha, Ashtanga Hridaya are given. So in this, the easiest method to study this thing is Sushruta and Ashtanga Hridaya Sharira. You can go through it. You might have studied Ashtanga Hridaya shlokas. The Sushruta Samhita is also in unison with Ashtanga Hridaya in many places. Just study those and note down the differential things mentioned in Charaka Samhita. That is how you need to go with this Shad-bhavas. So in that, specifically, there are a few confusion points like in Utsaha. This is said in Rasaja Bhava as well as in Sattvaja Bhava. So Rasaja Bhava by one Acharya, while Sattvaja Bhava by another Acharya. I'm not mentioning the Acharyas here because you have to go and refer it. The same way, Siras Nayu Dhamani is mentioned as, extra, or it is not mentioned by Charaka, but it is mentioned by Sushruta Acharya. So those small points you will have to note. While for Charaka, Madraja Bhavas are very similar to the Koshtangas mentioned by Charaka, right? So in that way, you can keep it connected also. Okay. So note down the confusion points in the Shad-bhavas. Also, there is another, interesting thing over there. When Shad-bhavas are mentioned, it is opposed by Bharadwaja, and he has given some reasons also. Just a one-time read would be enough so that you can know actually what is mentioned over there. Okay. Now, 75th question. According to Acharya Charaka, Jugupsa Chigilsa is done in which of the following? So, from 61 to 75, within that, Rajakma has been repeated twice, right? We saw the Chigilsa Sutra, and now Jugupsa Chigilsa from Rajakma again. So, this shows how important Rajakma Chigilsa is. Please do note this Jugupsa Chigilsa, what Mamsa is given instead of what Mamsa. Okay, what Mamsa is named instead of what Mamsa. Now, 76. It is a match the following from Dravya. So as far as Dravya drugs are concerned, you have to know, you should know about the Sanskrit names, the common names for it, the family and scientific name. These four things are very, very important. Learning this, after this, you can go to, popular synonyms or yogas or chemical constituents, all that in the second phase. The first thing you have to learn for a drug is its common name, its scientific name, and its family. And that is very compulsory about the drugs. So the answer is direct. Tilla belongs to Pedalaceae family. Jaba, which is hibiscus, it belongs to Malvaceae family. Padmaga belongs to Rosaceae family, and Gokshura to Zygophyllaceae family. Now, 77. Which of the following is the drug of choice for Shiro-virejana? This question is from Charaka Sutra, second chapter. You have a lot of, drugs mentioned over in this second chapter, categorized into each group according to the karma they perform. So, Shiro-virejana dravyas, Abhamargasya bijani, Pipali, Marijani, Vidangani, Chigruni, Sarshaba, Tumburuni, etc. All these drugs are mentioned. Just go through the drugs. And the confusion points you need to note here are, grouped drugs are mentioned in each of them. Like Trigadu is mentioned in Nasya, while Trifala is mentioned in Virejana. Lavana Dwaya is mentioned for Nasya. Lavana Panjagam is mentioned for Asthabana Anvasanam. Dashamula for Asthabana Anvasana. Pippali is mentioned for Nasya as well as Vamana. And Madana Phala is mentioned for Vamana, Asthabana, and Anvasana. Well, one confusion is when you come to Charagam Sutra, 4th chapter, Shadvirejana Shatashradiyam, there Madana is a member of Asthabana and Anvasana alone, not Vamana family, right? Vamanobaga Gana does not have Madana Phala there. But in 2nd chapter, Madana Phala is mentioned in both Vamana, Asthabana, and Anvasana. Okay. Now, Pilu is another drug mentioned for Nasya as well as Virejana. So these are a few confusion points which you have to note over there. Also give a good read of all the drugs coming under each karma, because they can be easily asked and you cannot guess them, right? You have to know what it is. 78. Arrange the following steps in the process of hypothesis testing. So when you all get admission and you enter the college for your PG studies, you will have to do your thesis work, right? Thesis work is one important thing in your PG time. So for that, you will have to you'll have to have a hypothesis to test it, right? You have to have a hypothesis to test it, and the testing and proving is your thesis work. So what are the steps involved in it? For testing a hypothesis, the first thing you need is you need a hypothesis first, right? You need to know in which topic you're going to do your thesis. So that is set up null and alternate hypothesis. This is the first step. Okay. The second step is you need to select the level of significance. Level of significance, which one is important, or which is to be taken as null and which is to be taken as the alternate hypothesis. Choose them. Then the probability, that is, how do you choose it? You need to know the probability of null hypothesis getting rejected or accepted. So you might be knowing what is null and alternate hypothesis, right? Those are the types of hypothesis. The third step is to select the test statistics. Now that you have your null and alternate hypothesis and you have decided as to what is to be null and what is to be alternate and what is the probability of rejecting or accepting the null, the next step is to conduct your the thesis work or the research work, which is the first step is that is the after selecting the null and alternate hypothesis, then you go for the test statistics. Okay, now which test you have to apply to compute the results? That is the next one. There are a few steps in between these also which are being omitted. The 5 steps mentioned in the question are only arranged here. Okay, now you have to select the test statistics, and then once you are decided with the test, then you have to establish the decision rule. That is, which one you're going to accept or which one you're going to reject. Then you have to perform the computations. Computations in the sense here, the computations means you have to come to a conclusion and then publish your result. So moving to the stages of hypothesis testing, the first thing you need to do is define a null and an alternative hypothesis. Okay, alternate hypothesis. Now, after defining this, you have to choose a significance level. Choosing the significance level means the probability of rejecting the H0. H0 means null hypothesis when it is actually true. If when you do your research, either null hypothesis turns to be true or null hypothesis turns to be false, and depending on that, you will be rejecting it or accepting it. So this is a little bit confusing now because you will not be knowing the inner portions of it in depth, right? So just understand that once you form a null and alternate hypothesis, now you will have to decide the significance level. What is significance level? It is nothing but the probability of rejecting null hypothesis when it is actually true. Once that is done, you will have to select the appropriate test based on the data, what data you're collecting, and what is the sample size. Your sample size, whether it is greater than 30 or less than 30, accordingly, you will have to decide the test which is to be applied. Then later on, after taking the test, you will have to make a decision. Now that you have decided on the test, you will conduct it, you will take the data, you'll analyze it with the test, all the statistical calculations are done, and then you'll come to a conclusion whether to accept the null hypothesis or to reject the null hypothesis. Okay, so that decision is taken, and finally the result interpretation will be done. So you can see the steps over here. Statistical decision is the the decision taken if to reject the null hypothesis or to accept it. This is a statistical decision. Now, do not reject null hypothesis, which means null hypothesis turns to be true and you're accepting it. Okay. If you reject the null hypothesis, what becomes alternatively the other one? That is, the alternate hypothesis becomes true and you accept alternate hypothesis. To explain it more, so for example, I'm doing a research, a particular kashayam is effective in diabetes or not. So let us take Kadaga Kadiradi kashayam is effective in diabetes. Okay, prameha. This is my topic of research. Let it be like that. So my null hypothesis would be Kadaga Kadiradi kashayam has no effect in counteracting diabetes. This is not as such. You have a lot to modify this research question and all. I'm just giving you an idea. So null hypothesis means you will say Kadaga Kadiradi kashayam has no effect in treating diabetes. My alternate hypothesis would be Kadaga Kadiradi kashayam is effective in treating diabetes. So this is how null and alternate hypothesis work. So when you study statistics, you might have studied when n is a sample size. When n is less than 30, you will take t-test. When n is greater than or equal to 30, then we'll take z-test. So these are types of tests. According to the sample size, according to the data we are collecting, we'll decide upon the statistical test. Okay, a few common tests are t-test, z-test, chi-square test, ANOVA, proportion test, etc. There are yet more tests also. Then coming to 79th question, given below are two statements as per Charaga Samhita. Statement 1 states, Nidra Bala Adihani is mentioned as one of the Lakshana of Vamana Adiyoga. Statement 2 mentions Nidra Bala Bhava is mentioned as one of the Lakshana of Virejana Adiyoga. So, like indications and contraindications for Panchakarma, Adiyoga, Ayoga, and Samyak Yoga of each procedure is very important. That too, specifically, you should study various opinions about Acharyas. Here also, apply the same logic, study any one, and then compare the others, write down the extra points alone. That is how you can study this too. So, Ayoga, Adiyoga, and Samyak Yoga, all three are very important. Okay. When you study Vamana Adiyoga, do give importance to Ashtanga Sangraham also, because there are a few symptoms which are not mentioned, which is only mentioned by Ashtanga Sangraha. Okay, so that would be a little. A few are mentioned by Ashtanga Hridaya also, but Vagbada has a little specific points mentioned which are not mentioned by Charaga and Sushruta. So do give importance to Vagbada also here. Like for example, Kukshi Hridaya Avishuddhi is mentioned by both Charaga and Sushruta, while Pidaga is mentioned in Virejana Ayoga. And Spoda Koda is mentioned in Vamana Yoga. So this is the way you have to find out the difference of opinion in each. Like Spoda Koda, then it is Vamana Yoga, while Pidaga, it is in Virejana Yoga. Hrit Kukshi Avishuddhi is mentioned in both Ayogas. The same way, Vamana Adiyoga has Unmada and Ardida, while Virejana Adiyoga has Unmada and Hikka. Okay, so Unmada is mentioned in both Vamana and Virejana Adiyoga, while Ardida in Vamana Adiyoga and Hikka in Virejana Adiyoga. Also, the Dosha Koba regarding each Adiyoga and Ayoga should also be noted. While coming to Samyak Yoga, the order of elimination is important. The order of elimination of doshas, that is to be noted in each Samyak Yoga. Another confusion point is Daham and Vidaha. Daha in Vamana Adiyoga and Vidaha in Virejana Adiyoga. So this way you have a lot of confusion generating points in this portion also. It is very difficult to note down everything, but at least important ones should be noted separately and you will have to go through it. Why do I insist noting down these separately? Because it is not possible for you during the last minute to keep on searching each and every note, right? So it is better that you keep a separate confusion book for this, note down everything separately so that you can have a last minute read without any issues. Now, 80th question. In reference of Kshara Karma in Bhrashtaguda, Sushruta has mentioned which of the following. So the context is Kshara Karma in Bhrashtaguda. Okay. Ksharadi Karma should not be performed in Bhrashtaguda. Ksharadi Karma should be performed by Darvi Kurchaga Shalaga in Bhrashtaguda. Ksharadi Karma should be performed without any yantra in Bhrashtaguda. Kshara Padana should be performed by Gandupadamukhi Shalaga in Bhrashtaguda. These are the 4 options given. So, Bhrashtagudasya tu vina yantrena ksharadi karma prayunjita. In Bhrashtaguda, vina yantrena ksharadi karma prayunjita. This is what is said. In case of prolapsed rectum or Bhrashtaguda, Kshara and similar procedures should be performed without the use of instruments. Why? Because it may cause trauma. If yantra is used, then it may cause trauma. So, it is advised to apply it manually without any instruments. Now, where is Darvi Kurchaga Shalaga indicated? It is indicated in Asadhya Arshis. Kshara application in Asadhya Arshis is done by Darvi Kurchaga Shalaga. It is not in Bhrashtaguda. So the second statement becomes wrong. Okay. And the first statement was wrong because Ksharadi Karma can be performed in Bhrashtaguda, but the only condition is it should be performed manually and not with any instruments. Now the fourth one, Gandupadamukhi Shalaga. Where is this Gandupadamukhi Shalaga used? Or what is, Gandupadamukhi Shalaga is used in Bhrashtaguda. That is what is given here. But we already saw that in Bhrashtaguda, there is no Shalaga used. It will be done manually or without any Shalaga, right? And in Asadhya Arshis, Kshara Karma should be performed with Darvi Kurchaga Shalaga. Darvi Kurchaga Shalaga is used there because it allows controlled application of Kshara. Okay, because tissue damage should be minimum, right? That is why Darvi Kurchaga Shalaga controlled application is mentioned over there. And now Gandupadamukhi Shalaga, it is used for Ashana Karma, right? So you have to go and find it out whether it is used in Bhrashtaguda, in Kshara application, where it is used in Kshara application, or at least what is the karma of Gandupadamukhi Shalaga. Okay. Now 81. Which of the following are the ingredients of Chadurangiga Dupa described in Kashyapa Samhita? Chadurangiga Dupa, it is Grudha, Majja, Vasa and Laksha. So all the Dupas mentioned by Kashyapa is very important, and you have to go through the contents as well as the indications of each dupa. Okay, here the indication is Alpa Doshe Krishe Bale Prayojyo Graha Vaigrade. So go through all the dupas mentioned by Kashyapa along with its indications and ingredients. 82. Xanthoprotic reaction is noticed in nitric acid poisoning. A yellow color would be there, yellowish discoloration, and the urine might have brown color. The yellow color is due to production of picric acid, which is called this xanthoprotic reaction. Okay, so toxicology is yet another important topic in forensic, where you have to study the fatal doses, fatal period, the reaction, specific reaction. There are specific reactions mentioned for oxalic acid, sulfuric acid, carbolic acid, etc. All those reactions should be, the changes which those acids produce in our body. That is to be noted. Now, 83rd question. What is the Netra Tarpana Kala Maryada suggested by Acharya Sushruta for a healthy individual? For a swastha, it is 500 Vak Matra by Sushruta. So the Kriya Krama is very important. Specifically, Tarpana, Anjana, Mukhaleba, all these are very important. The time period and the procedure stands very important for each Kriya Kalpa procedure. Now, coming to Tarpana, it is very important if you combine Ashtanga Sangraha, Ashtanga Hridaya, and Sushruta. Learn any one of these and then just note down the differences mentioned. Like when comparing Ashtanga Sangraha, Ashtanga Hridaya, and Sushruta, the difference is mentioned only for Pitta and Kabha. Right? So, note down those differences alone so that one you have to memorize of any one of the acharyas, and then you have to note down the differences of other acharyas. So Sharangadhara Samhita also, it follows a pattern. You can just note down the pattern so that it would be easy. Like for Ashtanga Hridaya, Ashtanga Sangraha, it is 100, 300, 500, 700, then 800, 1000. The first column, Vatma, Sandhi, Shukla, Krishna, Drishti, Adhimanta, Vada, Pitta, Kabha, and Swasta. This order you need to by heart so that the other columns would be easier for you to calculate. Okay. Just study one and then compare with the others. Note down the difference. 84. The feature of discharge from the Mamsa Gada Vrana. So, this is from Sushruta Sutrasthana. There have been repeated questions from this area. Asadhya Vrana Lakshanas are Srava from Pakvashya is Pulagodaga Samgasham. Srava from Rectashya would be Ksharodaga Niba. Srava from Amashya or Trigasandhi is Kalayambu Niba. These three Sravas are Asadhya Vrana Lakshana. Now, there are also, according to the site, that is Tvak Mamsa Sira Snayu, Asti Sandhi Kosha Marma. Each site has specific type of Srava. Like for Tvak Gada, it would be Salila Pragasha, watery discharge would be there. For Mamsa, it would be Sarpi Pragasha, which is the question here. Now, Siragada, it would be Toya Nadi Biriva Toya Agamanam Puyasya. Snayugada, it would be Singhanaga Pradimam. Astigada, it is Shukti Daudam Majja Mishram. Sandhigada, it would be Pidyamano Na Pravartate. That is, if you express it, it won't come out. But when you move the joints, it would come out. Srava, it will be Pichila, Avalambi, and Sarudira Rudironmathita. Now, Koshtagada, it would be Astrik Mutra Purisha Puya Udaga. Astrik, it will be mixed with Astrik Mutra Purisha Puya. And Marmagada is included under Tvak itself, according to each of, that is, what kind of marma it is. If it is Mamsa Marma, then it would be Mamsa Gada Vrana like. If it would be Sira, then if it is Sira Marma, it would be Sira Gada type of Srava. So that way. So study these points. They are very important. Also, according to the dosha predominance, each site would be giving out a specific type of Srava. Like for Tvagada, if it is Vada dosha predominant, it would be Parusha. If Pitta, it would be Gomedaga. If Kapha predominant, it would be Navanida Sadrisha. And if it is Sannivada, it would be Naligera Udaga Sadrisha. So that way, this table is also very important. You need to study the Srava according to the site as per dosha. Now, Srava due to Recta will be as in like Pitta itself. Okay. But it would be Adi Visram, more Visram than Pitta. Now, 85, Vrishya Guliga is mentioned in which of the following pada of Vajigarana Adhyaya of Charaka Samhita? It is Pumanjada Baladigam Adhyaya. So, just learn the, chapter names of Charaka Vajigarana Adhyayas, each pada, and how many yogas are mentioned in it. And it is practically impossible to learn all the yogas, but a few very popular yogas can be noted down as from which chapter it is being asked. Like, for example, Vrishya Guliga. So the yoga is given here. Just give a good read of it. By taking this Guliga, what is the Falashruti mentioned? Tasam Prayogat Purushaha Kulinga Iva Hrishyati. Kulinga means sparrow or Kulinga. Kulinga Iva Hrishyati. the happiness you get will be like, or excitement you get will be like sparrow. That is what the Rishya Gulika says. And the matra of the Gulika is Udumbara matra. Okay. So note down the important points like the matra, the anupana, the specific indication, like here the specific effect which is mentioned for each Gulika. Those things you can learn, and from which chapter it is given. I'm not mentioning for all yogas, but a few important yogas alone, at least you will have to learn. Okay, now 86th question. Shankadanda Venuvadi Daridam, according to Rasaratna Samuchaya, this verse is related to collection and storage of which of the following bhasma? The answer is Rasabhasma. So Rasabhasma has a lot of preparation methods. It is impossible to study all those preparation methods. So just go through it, read, and know about 2-3 preparation, at least 2 preparation methods, and just go through all the preparation methods so that you can identify the ingredients or the process of preparation. So once you see it in a question, you can at least realize or recognize that this is regarding Rasabhasma. Okay, so one method is like Parada with equal quantity of churna of Palasha Bija and Jivaka Kanda are rubbed. Or Mardana is done in Rekta Jambira Rasa, and then a ball is prepared and Sharava Sambuda is done, and Valuga Endra, using Valuga Endra, it is heated to obtain the Bhasma. This is one method. There are other methods also where other ingredients like Apamarga, Apamarga is used, seeds of Apamarga is used, Bhavana with Kanji is done, Eranda, Devadaru, all these drugs are also used. So just note down the drugs used. At least you will get to know that these drugs are used in the preparation, one or the other kind of preparation of Rasabhasma. And certain methods have mentioned the number of pudas to be given. So you can note those down. Or if any yantra in particular is mentioned, like Budara Yandra is mentioned, Valuga Yandra is mentioned in yet another preparation. So those yantras are mentioned in Rasabhasma preparation. That also you can note down. Now the important part is the question has come from the storage. Rasabhasma is stored in a container made of Shankadanta and Venu. And now when you administer it, you should administer it keeping it in between Parnakanda or betel leaves, along with proper Anubana. Then Patya is also in. Patya and Apatya is important, specifically Apatya. When you consume Rasabhasma, the Apatya is important. In addition to Kagaradhigana, what are all the things you have to avoid while having Rasabhasma, that you have to note down. Also, the Vyapat and management during Rasabhasma intake. That is, a person when he takes Rasabhasma, if he gets Udgara, what is to be done? If he gets pain due to Vada Dosha, what is to be done? If it is Arathi, what is to be done? If it is Trishna, what is to be done? So these 4 points are very important. You need to study them. Also, to improve the potency of Rasabhasma, what is to be done? Draksha, that is, you take Rasabhasma and you need to improve the potency or action of Rasabhasma, then you can, have Draksha, Dadima, Kharjura, Kadali, all these things to improve the potency of Rasabhasma that you intake. And also, when Rasabhasma intake is stopped, you should consume Brihati and Bilvafala. That is also an important point. Now, 87. Lekhana Anjana is prepared from which of the following types of drugs? So here, 2 answers have been accepted just because that the name of the Acharya was not mentioned here. So according to Sushruta, all rasas except Madhura is used for Lekhana, while for Sharangadhara, Kshara, Tikshna, Amla rasa is used. For Ashtanga Hridaya, except Tikta and Madhura rasa, all other rasas are used for Lekhana. So here, Sushruta and Ashtanga Hridaya, both opinions can be taken from the options, and that is why you have got 2 options over there. So all except Madhura by Sushruta, all except Madhura and Tikta by Ashtanga Hridaya, Kshara, Tikshna, Amla rasa by Sharangadhara. Okay, so 88th question. Given below are 2 statements. Statement 1 says According to Ashtanga Hridaya, the Aushadha Sevana Kala for Hidma is during night. Statement 2 says, according to Ashtanga Hridaya, the Aushadha Sevana Kala for Vyana Vayu Vigriddhi is at the end of the morning meals. So which statements are correct accordingly? That is what the question says. So Aushadha Kala is very, very, very important. Probably most of you might have studied any one of the acharyas like either Charaga or Ashtanga Hridaya. So whatever you have studied, do memorize those and then note down the difference of opinion of other acharyas. Mostly they are similar only. Like for Sushruta, for Charaga, for Ashtanga Hridaya, mostly they are similar only. Only Sharangadhara has divided the Kala a little bit differently, like 5 main kalas. That too, when you have the subdivisions of each kala, you will get all these, kalas according to other acharyas itself. But then the main classification of Sharangadhara includes 5 Aushadha kalas. But for others, it is 10, and for Ashtanga Sangraha, it is 11. So do note the number of kalas mentioned by each acharya. For Hikka and for Vyanavada, Vyane Ante Pradarashasya. So here it is said, according to Ashtanga Hridaya, Aushadha Sevana Kala for Vyana Vayu Vigriddhi is at the end of morning meals. Vyane Ante Pradarashasya. That is right. For Hikka, they have said Nishi, but for Hikka, it is not Nishi, it is Muhur Muhu. There are 2 Aushadha Kalas mentioned for Hikka, Muhur Muhu and Samudga. It is not Nishi. For Nishi, it is Urdhva Jatrugada Vigaras. So just make sure you study what you have already covered in UG and then note down the difference of opinion and give a comparative study. Sharangadhara alone, you will have to study it completely. Okay. Now, 89. Given below are the 2 statements. Choose which one is the most appropriate. 36 hours after birth, a full-term neonate has a total bilirubin level of 14 mg per deciliter. In this case, continuous phototherapy is recommended. This is statement 1. Statement 2 states phototherapy is indicated to reduce bilirubin level and to prevent kernicterus. So statement 2 is very easy. It is correct. We know it, right? Statement 1, you have a few points to note. See, the child is born 36 hours back, right? So 36 hours completed after birth. Now, it is a full-term neonate. Okay. And the bilirubin level is 14 mg per deciliter. And they are saying in this condition, phototherapy, continuous phototherapy is recommended. Okay. Let's see. For newborn, bilirubin levels, like 0.3 to 1 milligram per deciliter can be the increase within 24 hours, first 24 hours. Within the 72-hour period, an increase of 12 milligram per deciliter is normal. 48 to 72 hours, the second day to third day, within these third day period, 12 gram mg per deciliter is a normal increase. Okay. Once it reaches third day, the maximum level is 12 and then it should come down automatically. It should gradually decline thereafter. So here what is given? A 36 hours after birth, which means it comes under the 48 to, that is between 24 to 48 hours. Okay. So that is fine. So physiologically, there will be increase. A full-term neonate, there is also no problem in that. But see the level of bilirubin, the maximum amount is 12 milligram per deciliter is the permissible amount to leave it as such. That is without phototherapy. Here the level is 14 milligram per deciliter, which is higher than the expected value, right? So there you will have to give what? Phototherapy. Otherwise, if it is within 12 milligram per deciliter, phototherapy wouldn't be needed. It will come down automatically. Okay. But the level of increase is 14 milligram and hence phototherapy is needed here. So the first statement also stands correct. Then yet another thing, the total serum bilirubin levels are pathological if it exceeds 5 milligram per deciliter on the first day. That is, until 1, it is normal. And if it exceeds 5 milligram, then it is pathological. And if it is 10 milligram increase on second day, that is, if it comes up to 10 milligram per deciliter on second day or 15 milligram per deciliter thereafter, that is after second day, if the increase comes to 15 milligram, then these are all pathological in term babies. And the treatment is phototherapy and exchange transfusion. Now, 90th question, Rasa Tulya Falaha is described for which of the following Dravya-guna Padartha by Ashtanga Sangraha? So, you know, Rasa and Vibhaga, both these act similarly, right? That is what is asked here, Rasa Tulya Falaha. So, for example, Madhura Vibhaga and Madhura Rasa almost have same characteristic features or same effects. Same way, Kadu Vibhaga, Kadu Rasa, they have similar characters, right? That is what Rasa Tulya Falaha indicates. In case of Vibhaga, you need to know the difference of opinion in number of Vibhagas mentioned by each Acharya. Like Acharaga and Vagbada goes with Trivida Vibhaga, while Parashara says Trivida Vibhaga only, but the rasas included are different from what Charaga and Vagbada has mentioned. Right? So those things should be noted in Vibhaga. Now, 91st question. Screening of the diseases comes under which of the following type of prevention? Primordial, primary, secondary, and tertiary. The answer is screening of diseases comes under secondary prevention. So, what is primordial prevention? Primordial prevention means you are preventing the risk factors. Okay. So, for example, to prevent obesity, we are regulating our life, activities, like day-to-day activities. We are regulating, we are doing exercise, we are excluding fast food to prevent obesity, to prevent hypertension. All these things we are doing, regular exercise, yoga, etc. All these are risk factor prevention. This comes under primordial prevention. While in primary prevention, what happens is you are already exposed to the risk factor, but you're preventing the disease occurrence. Like, for example, there are malaria, chickenpox. All these are, we are exposed to all these factors, all these risk factors, right? But we take vaccines against them. Why do we take vaccine? Because we do not want it to progress towards the disease occurrence. That portion is called primary prevention. Well, secondary prevention is the early detection. Okay, early detection. The disease has occurred. You are exposed to the risk factor. You have already developed the disease, but we are detecting it early, or we are screening it in the earlier stage. That is what secondary prevention does. So all the screening tests, all the initial detection of the diseases comes under secondary prevention. Okay, now tertiary prevention. You are exposed to the risk factors, you have got the disease, and the disease has progressed to a certain extent. Now, the step is to reduce the sequelae or the after effects or the disabilities, right? That portion is called the tertiary prevention. That is, you are going for a sequelae prevention or a rehabilitation or disability limiting. This kind of prevention is called tertiary prevention. Okay, so primordial means you are preventing the risk factors, or you are preventing from getting exposed to the risk factors. So there is no question of disease development, right? Primary prevention is you are exposed to the risk factors, but then you're preventing from the disease occurrence. Okay. Secondary prevention is you're already acquainted with the disease. You've got the disease, but it is not progressed. You're at the earlier stage of disease or the screening stage of disease. So all the screening and all the early detection, case finding programs come under secondary prevention. And tertiary prevention, you've got the disease and the disease has progressed to a certain extent, and now you want to prevent the sequelae or the after effects or the disabilities, and you want the rehabilitation, and that is what happens in tertiary prevention. So this is what stages of prevention or levels of prevention says. Now, the next question, 92, it is, which of the following are used in the preparation of Bilva Taila? Bilva Taila is yoga used in Badarya, Karna Rogas, right? So Bilva Taila, see, looking at the options, even if you don't know the, the yoga of Bilva Taila, at least by knowing the context of Bilva Taila, you can guess the answer. See, look at the options. Option E is there in every single option, right? 1, 2, 3, and 4 has E. So E is obviously there. Now, coming to the other 4 options, can you note a specific, pattern? Gomutra, Ajadugda, Ajamutra, and Godugda. So, how to, analyze it? When you see these options, obviously, one would think that you will have one mutra and the other dugda. That is what more chance, right? This is a rough guess, okay? If you don't know a question, you don't know the context of the question, and you are yet to complete the target level question attempting, then you might have to attempt a few questions out of wild guess, right? So it is better not to wild guess, but to have some logic in that guess. So that is what I'm speaking about. So here it is Gomutra, Godugda, Ajamutra, and Ajadugda. So obviously we'll think any one mutra, that is either Gomutra or Ajamutra would be there, and the other option would be either of Godugda or Ajadugda. See, for Bilva Taila, we have already said it is from Badarya context, right? Or Karna Roga context. So you have already studied Karna Roga, that in Karna Roga, Gomutra Puranam is already said. So there is some logic to select Gomutra, right? So Gomutra option is A. You have 2 options, 1 and 4 has A as the option. Now look at those, the left out one. Option 1 has A, B, and E, where B is Ajadugda. And option 4 has A, D, and E, where D is Godugda. So we have already taken Gomutra. Then there would be chance for Ajadugda. You can take a wild guess of Ajadugda, and that was actually right. So Gomutra, Ajadugda, and Jala are the components. Mode of administration of Bilva Taila is Karna Puranam, and the indication is Badarya. So Ajakshiram and Jalam are 4 times of Taila, each 4 times of Taila. Now, 93, give the sequence of timeline and establishment of following events in respect to Ayush by Government of India. This is yet another question which you can answer with your logic. Okay, so see the options. The first is recognition of Sovarigpa under IMCC Act. B says Ministry of Ayush. C is Department of ISM and H. D is WHO GTMC. And E is Department of Ayush. WHO GTMC is Global Traditional Medicine, right? So now looking at these options, you can very well say that the first option would be obviously what? Department of ISM and H, which was the previous name of Ministry of Ayush, right? So C should be the first option, and see the first 2 and 4. These 2 options have C as the first thing, right? So one of those would be the answer for sure. So you have omitted 1 and 3. Now 2 and 4. Coming back to 2 and 4, check what is the next option given. For 2, option 2, it is C, later on A. For 4, it is C and E. See, recognition of Sova Rigpa under IMCC Act, which means Sova Rigpa is being added to Ayush, right? If Sova Rigpa should be added to Ayush, before that, you need a Department of Ayush or a Ministry of Ayush, right? There should be a Ministry or Department of Ayush, and only then you can add Sova Rigpa. That would be the sequence, right? So the second option obviously would be Department of Ayush. And that way you have reduced to one option, that is fourth option is the only correct answer here, but you can check other options also. Now after E, it is A, which is recognition of Sova Rigpa under IMCC Act. Now the next one is Ministry of Ayush. So the ministry has formed, and then at last finally WHO GTMC, that is Global traditional medicine recognition has happened. So here it is given Department of ISM and H, that is Indian Systems of Medicine and Homeopathy. It was in 1995. This is the first dedicated department under the Ministry of Health and Family Welfare to oversee traditional systems. So 1995 was the Department of ISM and H that came into existence. Now 2003 Department of AYUSH, it was converted, or it was renamed as Department of AYUSH. So ISM and H was renamed and restructured as the Department of AYUSH, where Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy became the parts. Now the third one, next one was recognition of Sova Rigpa under IMCC Act in 2010. Sova Rigpa was formally recognized through IMCC Amendment Act as a system of medicine. Then came the Ministry of Ayush in 2014. The Department of Ayush was elevated to a full-fledged Ministry of Ayush. And the fifth event was WHO Global Traditional Medicine Center, which was inaugurated at Jamnagar, Gujarat with Government of India support, which was in 2022. Now moving on to the 94th question. According to Charaga, which of the following statements are correct? This is very, 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 very important. You have to note these points down separately and study it as such. Sthananupurvi Chikitsa. In Madhatyaya, Charaga states Kabha should be treated first. While in Sannipada Jwara, Kabha is to be treated first by Charaga and Ashtanga Hridaya, while Pitta should be treated first by Sushruta. Sannipadika Adhisara, Vada is to be treated first by Charaga, while Pitta gets the preference by Sushruta. In Sannipadika Mudra Krichra, Vada Sthananupurvi Chikitsa is mentioned by Charaga. So, in Madhateya, Kabha is the first dosha to be treated. Sannipadika Jwara, Kabha is to be treated first by Charaga and Ashtanga Hridaya, while Sushruta says Pitta. Sannipadika Adhisara also, Pitta is the first dosha to be treated as per Sushruta. Okay, so wherever Sushruta is mentioned, he has mentioned Pitta as the first dosha, right? While Charaga has mentioned Vada as the first dosha in Sannipadika Adhisara, which is to be treated. In Sannipadika Mutra Krichra, Vada is again the predominant dosha or the first dosha to be treated according to Charaga. This is yet another confusion point. You can copy it down as such and then study it. Okay. Now, 95. According to Sushruta, Dhairya is the function of which one of the following Dhatu? I already said normal functions of Dhatu, Vriddhi, Kshaya Lakshanas of Dhatu, Dosha, Mala. All these things are very important. You've already got one question before. Now the second question from the same area. So do study that area. Don't just keep reading from the book itself. Do write it separately and read it every single day for a few days so that you get a proper catch of the topic. Okay. 96. According to Acharya Charaga, which of the following is a Purishaja Krimi? Yet another very important topic. You have to study the names of, first the number of Krimis, then the names of each dosha predominant or each what is Purishaja or Rektaja or Kabhaja or Malaja Krimis, the number, the Prakriti, okay, the form, the structure of each type of Krimi, then what are the symptoms of each type of Krimi. All these things should be studied. The names are very, very important, not only according to Charaga, but also according to Sushruta. At least give a read of Sushruta's name so that you get to know. If at all asked, you need to recognize or realize that these are Krimi names by Sushruta. Okay, so do check the type of Krimi also. Like if it is Kipya, which type of Krimi is that according to Sushruta? If it is Pipiliga, which type is it? So that is also important. And Krimi, the whole chapter is very, very important. The Chigilsa, the order of Chigilsa, all these are very important. Nothing to skip from that chapter. So Charaga Vimanasthana, 7th chapter is very important. Okay. Now put the following Vrana Upakramas in order of use in Vrana Shodha. It is very easy. the order. Everyone must study the order. Vimlapanam, Avasejanam, Upanaham, Padhanam, Shodhanam, Ropanam, and Vaikritabaham. That is the order. Now, Ado Vimlapanam Kuryat, Dvitiyam Avasejanam, Tritiyam Upanaham tu, Chaturtam, Padana Kriyam, Panchamam, Shodhanam Kuryat, Shashtam, Ropanam Ishyate, Ete Krama, Vranasya Uktaha, Saptamam, Vaikritabaham. So, those who have studied the shlogam, do study it or arrange the order and study the order alone. Okay. Now, 98th question. I said dates and years have been asked in this question paper twice. So, do give importance to dates and days. So, specifically in ISGK and all. United Nations General Assembly had declared 21st June as International Yoga Day on 11th December 2014. Look at the options. They are very, very confusing, right? So, make sure that you study the dates and years in particular. Now, 99th question. Which of the following statements are related to the preparation and use of Anutaila is incorrect? Okay. Charagam, Sutram, 5th chapter. Matra Shitiyam Adhyayam. So, preparation and the mode of usage, both and the matra as well, is important for Anutaila. So, we know from making the kashaya, initially, kashaya is made using the drugs with 100-fold Mahindra Jala. This is reduced to 10 times, which means 10 times of Taila. Okay, 1 part Taila with 100-fold water. It is reduced to 10 times kashaya of Taila. Okay, and each again, you're going to, boil it along with Taila for 10 times. And each time you will be adding this 1/10th part of kashaya and boiling it. Paga is done. And the second time again, 1/10th of kashaya is added and you'll again boil it. Then again, third time 1/10th is added. This way, 10 times paga is done. And the 10th time you add this 1/10th of kashaya along with Taila Sama Ajadudda. Okay, so kashaya is prepared from the drugs. The drugs are taken with 100-fold water or Mahindra Jala in specific. Now it is reduced to 10 times of Taila, and when you continue with the paga, 10 times paga is done, each time with 1/10th of the kashaya. And during the 10th paga, 1/10th kashaya, 1 part Taila, and Taila Sama Ajadugda is taken for the paga, the last paga. Okay, the matra of Anutaila is half pala. Now, 100th question. Which of the following is not the feature of Kubilu poisoning? Kubilu poisoning, Kubilu is Strychnos nux vomica. It is a spinal poison. Strychnine, brucine, etc. are the active principles. And the source is seeds. Kubilu seeds are poisonous, right? Strychnine is more powerful and it resembles tetanus poisoning. So you can see features like opisthotonus, emprosthotonus, pleurostotonus, etc. And there will be post-mortem caloricity because the heat is, the characteristic feature of Kubilu poisoning. Then convulsions, like we already said, it resembles tetanus poisoning. Convulsions and muscle twitching is also seen. Then rhesus sardonicus, it is a spasm of facial muscles causing a specific type of grimace. Okay, so that is also seen in Strychnos nux vomica poisoning. Now, what is the option here? Run amok is not seen in Kubilu poisoning, but it is rather seen in cannabis poisoning. Okay, ganja or cannabis poisoning. What is run amok? Run amok is whoever has got this poisoning or this cannabis or ganja poisoning, they tend to act very violently, and they tend to attempt to kill the person before them, assuming enmity. So it is very violent action. That is what run amok is. Okay, so when you study, again, yet another question from the toxicology part of, we have already seen nitric acid poisoning. Then again, second question from the toxicology part itself. So as I told you, fatal dose, the treatment, the specific features, all these are very important as far as toxicology is concerned. Okay. specifically for Upavishas. Now, question number 101. A patient comes to the OPD with complaints of diarrhea with ingested food particles and mucus. He has diagnosed with Apakwa Adhisara. Which action is required to treat the condition? So, Apakwa Adhisara, this is a little application based question, right? So we have a few conditions mentioned here. What is that? The patient comes with a diarrhea. Okay, he has indigested food particles and mucus. So it is like amatva is present, and also it is mucus is also there, right? He has diagnosed with Apakwa Adhisara. Which action is required to treat the condition? Now, on seeing the options itself, you can just omit two of them. Like Sandhaniya doesn't fit here. Stambana. Do you do Stambana in Apakwa Adhisara? No, right? So Stambana and Sandhaniya is right away eliminated. Now you have only two options, Grahi and Purisha Virajniya, right? So both these can act in this condition of Apakwa Adhisara, or but which is more suitable? See, there is mucus, there are indigested food particles. What does Grahi mean? Grahi means Deepanam, Pajanam, Drava Shoshana. According to Sharangadara's definition, it is Deepanam, Pajanam, and Drava Shoshagam. Right? Do you think these three properties are needed to treat this kind of Adhisara? Yes, right? Already it is Apakwa. So Deepana Pajana will help in making the Agni correct, and then this Apakwata will be treated, and Drava Shoshaka property would absorb or would make the mucus part treated, right? So these three qualities of Grahi would work wonderfully in such conditions, and hence Grahi is the most suitable quality of drug which is needed here. Okay, so that is what the logic behind this question is. Now, as far as Adhisara is concerned, as I told you, for every other KC disease, Adhisara has synonyms. You need to know the synonyms of Adhisara. Then what is Adhisara? What is the difference from Grahani? Then the important types, also the Nidana. Ambu-related Nidanas are present in Adhisara. The specific Nidanas, those should be noted. Then each dosha predominant Adhisara, the Purva Rupa is very important. You can see Vibanda in it, and then later on it develops into Adhisara, right? So you will never expect that. So those points are very important. Coming to Rupa also, each kind of Adhisara, each dosha predominant Adhisara will have different characteristic features like Vada, Pitta, Kapha and all. Those should be noted, like Shadvala Prabham. All these things should be noted. When you come to the treatment part, the Adhisara Chigilsa principle is very important. Along with that, there are a few important conditions mentioned in Adhisara Chigilsa. That is very, very, very important. Like, for example, in Ama Adhisaram Chigilsa is important. Like in Ama Adhisaram, Alpe Langanam, Madhya Langana Pajanam, Prabhude Shodhanam. In Madhya, when it is Langana Pajanam, where Pramatya is being used. For Vada, Pitta and Kapha, different Pramatyas are used. And if the patient is, Balya, or there is proper, Bala for the Rogi, then Stambana should not be given. So these conditions should be noted down. Along with that, there are a few conditions specifically mentioned for Adhisara, like Tadarthagari Chigilsa conditions are mentioned, where those are very important. Those points should be noted down. Like Adhisara with Pravahika will be given Bala Bilva Galam. When you have Prasega, Adidravam, Prabhuda Purisham, then Vamana can be Dananaha Praseka. Those conditions, Vamana is given. When there is Agni Deepti, but Vibandam Adhisaride, there is already Agni Deepti, but Agni is okay. But then Vibandam Adhisaride, it is not going properly out. Then what should you do? Virejana with Krishna Vidanga Trifala should be given. Same way, Pranada Doshe Vibande Sampravartini, that quote comes here. wherein the condition is Vibandhatvad Admanadigarini. Admana and Vibandha. When Adhisara is with Vibandha and Admana, then Pranada is to be used. Stogam Vibandham. Then with Shula, if it is with Shula, Stogam, little by little it goes with Vibandham. Then Sukhoshtam Abhaya Vipali Kalkam should be given. So this way, there are a few conditions very important. Those conditions should be noted in Adhisara. And yogas also are important. Now, question number 1 or 2, according to Acharya Charaka, which of the following is not the ingredient of Dibaniya Shulagna Yavago? Again, you have it from Charaka Sutra, 2nd chapter. There are 2 questions again, right? So, Shulagna Yavago is Panja Kolam, right? Panjagolam. Maricha is not an ingredient. Rest others are ingredient. So, also study all the 28 types of Yavagu mentioned over there. 103. What dose of Niruhavasti should be given to a 14-year-old boy? So, Niruhavasti dosage, 1 year it starts with 1 pala. Then every successive years you increase it with 1 pala. Like that way you reach 12 pala by 12 years. That is 12 pala or 6 prasridam. And later on from 12 years, you will have to increase 2 pala each year. So that by 18 years, you will reach 24 pala or Dwadasha prasridam. So that is the full dose, Dwadasha prasridam. From 18 to 70 years, it will be 12 prasridam or Dwadasha prasridam. Okay, so that way you can calculate. So starting from first year, 1 year, 1 pala, 2 year, 2 pala, 3 year, 3 pala. Likewise, you will increase until 12 years. So by 12 years, it will be 12 pala. Once 12 years is done, from 13th year, you will be increasing 2 palas per year. So it will be, for 13 years, it will be 14 palas. For 14 years, it will be 16 palas. Likewise, by 18 years, you will come to 24 palas or 12 prasridam. That is Dwadasha prasridam. From 18 to 70 years, it is Dwadasha prasridam. Once after 70 years, it will be 10 prasridam according to Charaga and Ashtanga Hridaya, by 16 palam or 8 prasridam according to Sushruta. Okay. Then 104. What is the right order of events during Vamana Karma after administration of Vamana Dravya as per Charaga? So you take Vamana Aushada. So there is one small confusion over there. Wait for 1 muhurta, whether it is in the first or whether it is in the last. So logically thinking, you take Vamana Aushada and the waiting period in total is mentioned as 1 muhurta, right? So once you take the Aushada, all these symptoms start happening one after the other. All these symptoms happen within that 1 muhurta period. So the first option should be waiting for 1 muhurta. Okay. And once you start waiting, what happens? You get sweating, Sweda Pradurbhava, while the Dosha Pravilayana occurs. Once sweating, Dosha Pravilayana occurs, and then it comes to Sthanebhyo Prachalitam. It starts coming out from where it resides now. Shakha, from Shakha, it starts coming to the Koshtam, right? So when it starts coming from the Shakha, you will get Roma Harsha. Okay. Now, after that, what happens? The dosha comes to the Kukshi, abdominal. Reaching Kukshi, you will get this Kukshi Admanam. Kukshi Admanam or abdominal distension. Now, once it reaches the abdomen, what happens? It starts coming up, right? Urdhva Mugham. When the dosha comes Urdhva Mugham, you will get Rillasa and Shravana. So it is fairly nicely correlatable actually. If you understand the meaning, you will get it. So here you have that. The only thing you have to note down is wait for 1 muhurta should come in the first, and the logic is that 1 muhurta waiting period includes all these reactions. Okay, so after Vamana, 1 muhurta rest is advised, and then Dhumapana is done. Okay. Now, question number 105. Sthana Tulavat Snayu Jalavanto is a feature seen in which of the following? Again, one more question from Sushrutam Sutram, 23rd chapter, Kritya Kritya Vidhi. So, all those options except for the 4th one are Kshudra-rogas. Okay. So, once you go through the Kshudra-rogas, you get to know that this kind of symptom or rupa or feature is not mentioned in any of these. But asadhya vrana, all those asadhya vrana are similes, right? So Shanatulavat Snayu Jalavanto. Sorry, Shanatulavat Snayu Jalavanto is a simile again, which comes to Asadhya Vrana. See, Asadhya Vrana, all are similes like Mamsa Pindavad Udgadam, Prasekina, Anda Puya Vedana Vanda, Ashwapanavad Danto, Ashwapanavad Udvrutta Oshtav, Goshringavad Udgadam. All these are similes, right? Mamsa Budbudavantam. So all these are similes specifically noted down. Asadhya Vranas are similes. Okay. Now, 106. According to Acharya Sushruta, which of the following type of water is indicated for Madhyabana Sambodha Roga? So, Madhyabana Sambodha Roga, the answer is Shruta Sheeta Jala. So, Jala Varga, this is from Sushrutam Sutram, 45th chapter. Okay. So, it is Jala Varga is mainly divided into Antariksha Jala, Vyapanna Jala, Peya Jala, Nadi Jala, Sheetambu, Ushnambu, and Narigelambu. So, Toya Gunam in general is Nirgandam, Avyaktarasam, Drishnagnam, Shuchi Sheetalam, Acham, Lagucha Hrudyam, Toya Gunavat Uchyate. Now, Antariksha Jalam. What is the Antariksha Jalam? The rain water is called Antariksha Jalam. Paniyam Antariksham Anirdeshya Rasam. So, for Antariksha Jalam, it is Anirdeshya Rasam. In Toya Guna, it is said Avyakta Rasam. Okay. So, just read out the qualities of each type of Jala. Antariksha Jala is rainwater, and the most, it is divided into Dharam, Karam, Tausharam, and Haimam. Dharam, Karam, Tausharam, and Haimam. This is the classification of Antariksha Jalam, Chadurvidam. And then this Dharam is the most important one among these four. The reason is Lagutvat. So there is an assertion reason over there. Now, Tat Puna Dvividam. Dharam is again divided into two, which is Gangam and Samudram. Gangam means Ashwayuja Masi Prayasho Varshati. The rainwater that comes down in Ashwayuja Masa, that is Gangam, and which comes except Ashwayuja Masam, that is called Samudram. And if among these Gangam and Samudram, Gangam is Pradana. Okay, then what? Samudram. So the gunas of Gangam is also given, and this same rainwater, when it falls on the ground, whatever dosha predominance or pancha-bhautikatva is of that ground, then it obtains what? Different tastes and different characteristic features according to the place it falls. Like bhuma amlam lavanam cha, ambu guna bhuishtam, then it is maduram. Tejo guna bhuishtam, it is kadugam and tiktam. Vayu guna bhuishtayam, it is kashayam. And agasha guna bhuishtam, it is avyakta rasam. So avyaktam hi agasham ityataha. That is called that Agasha Guna Bhuishta Jalam or Agasha Guna Bhuishta Pradesha Jalam is called Bhauma Jalam. Okay, this Bhauma Jalam is again divided into 7 types, which is Kauvam, Nadeyam, Sarasam, Tadagam, Prasravanam, and Audbidam and Shaundyam. 7 types. And each type has its own dosha Shamana and dosha Prakopa characters, features. So just give a one-time read for that, all these qualities, because it is impossible to study. It is difficult to study each and everything. Okay. Now, basic classification after Antariksha Jalam, it is Vyapanna Jalam, which is Vyapanna Jalam means it is polluted water. Okay. Nava Jalam, that is new, like Nava Jalam. It is Gaganambu Tradoshagnam Grihidam Yat Subhajane. When you get it in a Subhajanam, that is clean vessel, it is Tradoshagnam. Okay. So just note it down that just to have an idea about the characters. One time read would be enough for all these. Now, Sheetambu, since this question has come, do read it once at least. Now, Sheetambu, there are conditions where Sheetambu is Varjyam, like Parshashulam, Pratishyayam, Vadarogam, Galagraham, Admanam, then Sadhya Shuddha Navajwaram. So, Sadhya Shuddha, that is immediately after Shodhana Karmas, Navajwaram, Hikka, Snehapidam, after Snehapana. So after Snehapana, if you have Shitambu, there is one disease which occurs, go search it, which is the disease. Okay, so that also accounts to a confusion point, because this Ambupana is a Nidana, different kinds of water intake is a Nidana to many diseases. So you can see it in Shalakyam, you can see a few diseases in KC. So go search it. So after Sadhya Shuddha or after Shodhana, immediately after Shodhana, if you drink Shitambu, it is contraindicated. If you drink Shitambu, you will get a disease. Okay, go search it. Now, Hikayam Sneha Pitecha Shitambu Parivarjayat. In these cases, Shitambu should be avoided. While Shitambu can be taken in certain conditions where Murcha, Pitta, Ushna, Daheshu, Vishe, Rakte, Madatye, Brahma, Klama, Parideshu, Tamake, Vamadhautada, Urdvage, Rektapittecha, Shidam Ambaha Prashasyate. In these conditions, Shitambu is indicated. Now coming to Ushnodagam, Ushnodagam has its own importance. It is being mentioned here in Jwara Chigilsa and also in third chapter of Charakam, Vimanasthana, right? So compile all those points so that you can get a clear idea of Ushnodagam and the conditions mentioned in each of these places. Now, Shruddha Shida Toyam, that is what the answer of our question is. Madhyapanat samudbhude roge pittotide tada. So, Shruddha Shida Toyam is the answer. Okay. Then now, Narigela Udagam, it is Basti Shodhanam, Deepanam, tender coconut water. Okay. So, it is Vrishyam. So, those points can be noted. Now, at last, contraindications for drinking water. Until now, we said different types of water where each water can be used. Now, there are a few conditions where drinking water is prohibited. The conditions like Arojakam, Pratishyayam, Prasegam, Shwayatu, Kshayam, Mande, Agna, Udare. Then Kushte, Jware, Netramaye, Tatha, Vranecha, Madumehecha, Paniyam, Mandamachare. Should be given in a lesser quantity in these conditions. Now, 107. Mutra Shukrasthan Doshamsha Apakarshati. Mutra Shukrashyam Doshamsha Apakarshati. Which Rasayana has this property? Mutra Shukrashyam Doshamsha Apakarshati. It is for Chavanaprasham. Chavanaprasha yoga, many of you might have studied. At least if you have not studied the whole yoga, just try to read a few times the Falashruti of the yoga. Okay. It's a big yoga, so I don't think everyone might have studied, but at least go through the important Falashruti of the yogas, of the Rasayana. Now, 108, according to Ashtanga Hridaya, types of Langana. One chapter of Ashtanga Hridaya itself gives the answer. Vividha Langana, right? Vividha Langana. So, Shodhanam, Shamanam, Cheti, Dvida, Tatrapi, Langanam. And this Shamanam is again divided into 7. Okay. So that is a direct question. The shlokas are also there in Ashtanga Hridaya. Now 109, according to Kashyapa Samhita, Anupana of Swarna Prashna Anupana is Madhu Sarpi. That is also a direct question. When you study about Swarna Prashna, do study the effects of Swarna Prashna. But for 1 month it is Medhavi, for 6 months it is Shrudhadara. This Shrudhadara is mentioned for other yogas also, like Nagabala Rasayana. Go search what is said and what dosage for what time it is said in those contexts. Okay. And coming to Ashtanga Hridaya, Swarna Prashna, there are 4 groups of drugs mentioned. There also Anupana is Madhu and Ghrida only. And Ashtanga Hridaya mentions for 1 year. Swarna Prashna. Hema, Shvetavaja, Kushta, Arka Pushpi and Kanchana. That is, Swarna is there in all the yogas. If you take out Swarna, the yogas would be Shweta, Vaja and Kushta for 1 yoga. Arka Pushpi for another yoga. Malsyaksha and Shanka for the 3rd one. Kaidarya and Vaja for the 4th one. Okay, so the 4 yogas you need to study the drugs also. Question number 110. When you study Swarna Prashanam, go for the Prashana before Garbhodaga Vamana, after Garbhodaga Vamana. The Prashana is said like in detail in Kaumaram. Give a good read of that along with Swarna Prashana. Okay. Now, match the following. Next one is a match the following from Mahakashaya concept. 50 Mahakashayas, they are to be studied. Like I think in 2024 or so, there were 4 questions from Mahakashaya. This time it was 1 question. So there is a good importance for the Charagam Sutra, 4th chapter. Somehow you need to study all those 50 Mahakashayas. Okay, that is a direct question. You can just, correlate each drug with the Mahakashayas. Now, question number 111, old name of Ayush and its establishment year is. Here also the options are very much confusing. Might be like old name of Ayush is known to everyone. Like Indian system of medicine and homeopathy is the old name. We've discussed in a previous question, this one. The year, see how, the years are being placed, 95 and 96. It's too confusing, right? That is why I insisted you study the years specifically. Okay, 1995 is the year. You need to keep some kind of connection with the year and this, fact. Now, Ministry of Ayush was formed on 9th November 2014. The vision was reviving the profound knowledge of our ancient systems of medicine and ensuring the optimal development and propagation of the Ayush system of healthcare. It was earlier known as Indian System of Medicine and Homeopathy. It was formed in 1995. Renamed as Ayush, Department of Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy in 2003. The focus is on the education and research of Ayush systems. Now, question number 112, given below are 2 statements. Statement 1, according to Acharya Charaka, Tikshna Samshodhana is done in Pandu patients. Statement 2 indicates, according to Acharya Charaka, Tikshna Samshodhana is done in Kamala patients. In the light of above statements, choose the most appropriate from the options given below. Now, KC diseases, Pandu and Kamala are also very important, specifically in Pandu. The Samprapti, then the Chigilsa Sutram, the yogas are very, very, very important. And do not miss Kamala, Kumbha Kamala and Halimaga. They are also very small, small diseases. You don't have so much to study in these diseases. So do not skip them. Okay, they're very, very basic, points given over there. So you have to study those. Treatment principle of Pandu, Vadige, Snehabhuishtam, Paitige, Tikta Sheethalam, Slaishmike, Kadu Tiktoshnam, Vimishram, Sannipadige. This is how the drugs should be. In Vada, it should be Snehabhuishtam, Paitiga, it should be Tikta Sheetham, and Sleshma or Kapha Pradhana, it should be Kadu Tiktoshnam, and Vimishram means mixture of all and Sannipatika. And Snehana is done, and then Tikshna Vamana and Anulomana is mentioned by Charaka and Pandu. Well, Snehana specific drugs have been mentioned like Kalyanaga Grada, Panjagavya Grada, Mahatiktaga, Dadimadi, Aragvadadi Gradas are mentioned for Snehana. So once Snehana is done with any of these Gradas, then Tikshna Vamana is given for Pandu, and then Mridu Virejana is mentioned. Okay, this is according to Charaka. Well, Ashtanga Hridaya says, Snehitam Vamaye Tikshnahi Punaha Snigdham Cha Shilayet. Once give Snehabana, then Vamana, Tikshna Vamana, then again Sneham should be given. Payasa Mutra Yuktena Bahushaha Kevalenava. According to Sushruta, what is that? Virejana should be done alpa for several times. Why? Because otherwise, if it is Tikshna Virejana, then it would cause Shvayatu. Okay, Shofa Chigilsa can be adopted judiciously in Pandu Chigilsa. And after Vamana and Virejana, for Dosha Shesha Shamanartham, Haridagi Churnam with Rajani Grudam and Trifala or Tilvaga Grudam is given. That is Alpa Virejana is done there. Okay. Alpa Dosha Shamana is done over there. Now, coming to Kamala, what does Kamala treatment principle say? Kamalayam to Pittagnam, right? Pitta, it is a Pitta predominant condition where Pittagna Chigilsa is to be done, but you should take care of Pandu-roga also. Pandu-roga avirodhi yat. which is not against Panduroga. That is important. Okay. Then Agnigarma in Kamala, the site is important. Manibandha is the site. The same way, Bhava Prakasha has mentioned Kumari Jala Nasya for Kamala. So these are a few important points. Not only this, but all the points mentioned in the notes are very important. Okay. So Mridu Tikta Virejana is what is said in Kamala. It is not what severe or Tikshna Virejana as given in the question. The question says Tikshna Samshodhana is done in Kamala patients, but Kamala Mridu Virejana is being done. And Pandu Tikshna Vamana is done. So that is how statement 1 became correct and statement 2 is incorrect. Okay. Then Shagashwada Kamala, Ruddhapada Kamala, Kumbha Kamala, all these, Halimagam, all these are important. Do study the yogas also for these, each of these. Now, question number 113, given below are two statements. Useful part of Naga Kesara is used to treat Rektasha is Stri Keshara. And as per Charaga, Naga Keshara is administered along with Navanita and Sharkara in Rektasha. Naga Kesara has this, Rekta Shamana property. So Naga Kesara is used, and the yoga is said as such in Charaga, like Navanita and Sharkara are given along with Naga Kesara. The only thing is, the useful part of Naga Kesara or Mesua Feria is not Stri Keshara but Pum Keshara. Okay, the Andretium part is used. This Mesua Feria belongs to Gattiferae family. And the yoga, which is given here, is Navanida Tila Abhyasa, Keshara Navanida Sharkara Abhyasa. So Navanida with Tila is given, Keshara, which means Naga Keshara, Navanida and Sharkara together is given. And this is what the question says. Dadi Saram Mathita Abhyam Sadar Arshamsi Apayanti Rektani for Rekta Arshas. Okay. So given below are a few treatments for treatment and yoga options for Rekta Arshas. Go through them. Just that Naga Kesara, Andretium part or Pum Kesara is used for the treatment. Okay. Now, question number 114. Feeling of scorpion bite like pain is found in which of the following disease? Scorpion bite like pain. Vrishika Vidhatulya Iva Vedana. Right? It is found in Amavada. Amavada is a very small disease, but very, very, very important disease. At times they ask the Chikitsa Sutra. At times it will be Sadhya Sadhita. Sometimes it will be the types mentioned. At times, like specific features, or you can expect rheumatic fever related or rheumatoid arthritis related questions. So it is very, very, very important. Amavada. Do study the whole disease. Specifically, the order of Chikitsa can be asked. Once it was asked, the order of Chikitsa was asked. So all these are important questions from Amavada. Okay. The types according to Harida, the names, and the Sadhya Sadhita for the Amavada according to Harida is also important. Do know the types so that when you hear this word like Gulmiki, Sarvangi, you need to realize or recognize that this is a type of Amavada mentioned by Harida. So just give a read accordingly. Okay. Now, this Vrishika Vidha Tulya Vedana is set for Amavada. There are similar points in other diseases also, other contexts also, which relates the Vedana to Vrishika Vidha or Vrishika Dashana. Okay, let's see a few. Like Vrishika Vidha Iva is said in Pachyamana Shofa, while Vrishika Dashana Tulya Vedana is said in Abhyantara Vidrati. Vrishika Vidha Tulya Vedana is in Amavada. So taking these three, it is almost similar, right? But there are actual differences in this. Vrishika Vidha Iva is Pachimana Shofa. Well, Vrishika Dashana Tulya Vedana is said in Abhyantara Vidrati, and Vrishika Vidha Tulya Vedana is said in Amavada. The same way, Hata Ashi Vishaviva is said in Shwasam. Darunam Rogam Asi Vishopamam is said in Visarpam. Ahoriva Visham Kruddham said in Badarekta. Agnivat Shigragari said in Rektapitta. Yathaiva Ashi Vishaha Kakshamadhyagaha Swavishagnina. Yathaiva Ashivishaha Kakshamadhyagaha Swavishagnina. This is said for Snehapana complication. Not any disease, but Snehapana complication. So these are a few confusion points regarding this Ashi Visha or Prishiga Vidha, etc. Okay, note these down separately and study it. The prognosis, as I said, for Harida and Madhavanadana is important as for Amavada. Do study that also. Then a few yogas are also mentioned where Airanda Taila is highly useful. So those things should be, should be mentioned over or studied over there. And the treatment order of the treatment is very important. Now, question number 115. Which one of the following symptoms is seen in Kumbhiga Shuga Dosha? Kumbhiga Shuga Dosha, which is the symptom. So, one is Jambavastinibha, B. Yagrutopama, C. Mudgamashobama, and D. Krishna Spodhabhratam. So this is from Shuga Dosha Nidanam, chapter 14 of Sushruta Nidana Sthana. There are total 18 Shuga Doshas mentioned by Sushruta Nidana. So the important, when you study Shuga Dosha, it is impossible to study each and every Nidana or each and every disease in detail. The thing you should do is just note down the dosha predominance said by each Acharya, and also the most important simile said for each Shuga dosha. Okay, like for example, Sarshabhiga, it is Gaura Sarshaba Samsthanam. It is Kabha Vadajam according to Madhavadana, while Kabha Rektajam according to Ashtanga Hridaya and Sushruta. For Ashtiliga, it is Kadina and Vishama. It happens due to Vayu Dosha Kopa. Gradidam, it is Shuger Yet Puridam, like thorns, it's filled with thorns. So Shuger Yet Puridam, it is Kabha predominant. Kumbhiga, it is Jambavastinibha, which is Rekta Pitta predominant, and that is what is asked for in the question. Allergy, it is similar to Prameha Pidaga, it is Tridosha, and Sushruta terms it as Vada predominant. Mridita is due to Pidanam. Vada Koba is the dosha Koba over there. Vada Rekta is said by Dalhana and Gayadasa. In this way, you will have to just go through the most important similarities mentioned and the dosha kobas for Shuga doshas. At least go through those things. Okay. Now, and what are the asadhya Shuga doshas? Mamsarbudam, Mamsapagam, Vidrati, and Tilagalaga are mentioned as asadhya Shuga doshas. And there are a few confusion in the names, like Sarshabhiga, when you say Sarshabhiga, Vidrati, allergy, these come under Prameha Pidaga also and Shuga dosha as well. Allergy comes in Netra-roga as well, right? And Vagbada has mentioned the Shudra-roga in the name of allergy. So, these are the contexts where the name allergy comes. Likewise, Kumbhiga is there in Vatmaroga as well as Shuga dosha. Shataponaga is in Bagandhara as well as Shuga dosha. Tilakalaga is mentioned in Kshudra-roga as well as Shuga dosha. So these confusions, just a one-time read would be enough. You'll get it easily. Now, 116. According to Acharya Sharangadhara, which among the following is a synonym of Drona? Mana Paribhasha. Mana Paribhasha is very, very important. You cannot omit any of those in Vaishijya. So the whole measurements as well as the synonyms, both are very important, specifically Magadha Mana. So do study the whole Mana. There is no other go. You will have to also do study the equivalents also in kilograms. For certain manas, certain commonly used matras, you need to study the equivalent, metric equivalents also. Okay. Then 117, write the management sequence of a sudden onset disaster. See, read the question properly. Management sequence of a sudden onset disaster. So, a disaster has already occurred, or it is a sudden onset. You are not expecting it to occur. It is sudden and it has already occurred. So logically thinking, what would be the first measure you would take? A, response, B, reconstruction, C, rehabilitation, D, preparedness, and E, mitigation. So when you see the first thing itself, which comes when there is a sudden onset of disaster, there is a flood, what will you do? You'll respond to it first, right? So the first thing is response. Now, after response, what will you be doing? You will be going for rehabilitation. That is a short-term solution to make people and properties safe. That is what the next step is, right? That is rehabilitation. Now, after rehabilitation, what will you do? You'll reconstruct. Once the disaster is done with its all those things, now you have to reconstruct everything, right? You will have to make sure that everything is put back to normal. That is called reconstruction, which is a long-term solution. Now, after reconstructing, what will you do? There will be a lot of after effects, so sequelae of this disaster, right? So you need to mitigate those effects of that disaster. So the next step would be mitigating all those. And last one is, if at all you need to encounter another disaster in future, you will be prepared for it. So this is the order. So first, sudden onset of a disaster, the first reaction is your response to it. The second one, you'll rehabilitate people for a short-term solution, as a short-term solution. Then once the disaster is subsiding, starts subsiding, you will reconstruct the destructed properties and all those things. You will bring back to normal, which is a long-term solution. And after that, you'll have to mitigate the effects of disaster, the sequelae of the disaster. So mitigation is done. And then in future, if at all disaster, a similar one comes, you will be prepared for it. The preparedness will be there. So that is how the order goes. Now, question number 118. According to Acharya Charaka, Rasayana Midam Sreshtam Sarvarogaharam Shivam. This is mentioned for Yogaraja Rasayana. There is no other go. You will have to, be thorough with a few yogas, so that specifically when yogas are asked, not only that if you know the yoga, you can answer. That's one way. If you might not know all the 4 options, but you might be knowing 1 or 2 options, the yogas of 1 or 2 options, wherein what you can do, you can check whether those are the answers, and if not, you can omit it and reduce the options to 2 or 3 from the 4 options. So that way also you can answer. Then certain yogas from your practice, from your practical knowledge, you might be knowing this can be used, or this is the context of the yoga, might be the correct falashruti. So this is how you answer a yoga, okay? Because all yogas are not feasible. It is not possible to study all the yogas. Now this comes in Pandu Chikitsa. That is why I said you have got 2 questions from Pandu Chikitsa itself. So Pandu Roga Chikitsa and its yogas are very, very important. Whenever you study a yoga, see that if you have any most important drugs mentioned, any anupanas mentioned, any matra mentioned, the context of the yoga, and any important falashruti mentioned. All these should be noted down. Now, question number 119. As described in the Ashtodhariya Adhyaya of Charaka Samhita, write the diseases in ascending order according to their number of types. So, it is asked ascending order, which means the least number of diseases should come first, and then towards the most number. So, Yoni Vyabhat, it is 20 in number, right? So, that way you can take each one of the diseases. Sannyasa is 1 type. Visarpa is according to Charaga, the number of Visarpa. Then according to number of Visarpa is 7 types. For Gulma, it is 5 types. And for Kilasa, it is I don't remember Kilasa number. So this is how it goes. So kilasa, I think it is 3. Yes, 3. So it is the least number of types is mentioned for sannyasa, which is 1 type. Then comes kilasa, which is 3 types. Then comes gulma, which is 5 types. Then comes visarpa, which is 7 types. And then comes yoni vyapat, which is 20 types. So this Ashtodhariya Adhyaya, also Nanatmaja Vyadhi. Both are very, very important. These 2 adhyayas, not a single thing has to be omitted. You have to study everything. Okay, you have got 2 questions from one each from these adhyayas in this paper itself. So do go through the number of that is a type of each disease. Okay, the last question number 120. What is a hypothesis in the research? So hypothesis is a statement that can be tested. A research hypothesis is a clear, testable prediction about the expected relationship between 2 or more variables. It is a statement which we will be testing through our research. Okay, so the statement that can be tested, it is called hypothesis. In Ayurveda, the counterpart, you get a similar, or the counterpart can be this Pancha Avayava Vakya Pratiknya, right? Pratiknya, Hetu, Upanaya, Nigamana, all those 5 things. It is this. It comes in Vada Marga, I guess, right? So that in that Pratiknya can be correlated to hypothesis. Okay. And types of hypothesis, we already discussed these. Null hypothesis and alternate hypothesis. Null hypothesis states there is no relationship between the variables which you are going to check. And alternate hypothesis says there is a relationship between the 2 variables. Okay. And testing of hypothesis, the steps of testing were discussed in another question. Specify null and alternate hypothesis first, then determine the level of significance. That is, if you're going to, what percentage, what proportion or probability of rejection of null hypothesis exists, that you have to determine. Then you select the test statistics. Once the test is done, you according to the decision rule. Decision rule means whether to accept or reject the null hypothesis. Okay, that is the decision rule. So establish the decision rule by which you can either accept or reject the null hypothesis, and then you have to perform the computations. Computations here means the final interpretations. Okay, so perform computations. Those are the steps of testing the hypothesis. So with this, we have come to the end of 120 questions. I hope all these questions are clear. Please do prepare very seriously. You have only a few more months left, and this few more months will decide your future. Okay, so all the very best for everyone watching this. You're all going to get nice seats in various colleges. So keep studying, keep working. Prepare separate notes, prepare confusion book, keep your points handy. From now on, whenever you revise, do note down the topics which you have to repeat again, because if you don't note it, what happens is at the end of the when you have only 1 or 2 months left, you will be in a hurry. You cannot decide which to study now, what portion you should study, because it will seem like you know nothing by then. Okay, you actually know things, but your confidence level would be a little lower because you have a lot to study. You'll be in the peak of the tension. So make sure that you note down points that are to be repeated again and again. Work out questions and do well. All the best.